Hello, good morning guys. My name is Dr. Wajid Khan. I'll be dealing with this topic of anesthesia. Let us start with the muscle relaxants, guys. Muscle relaxants. Muscle relaxants are what drugs? When do you call a drug called muscle relaxant? Muscle relaxant is a drug when given to a person, it will cause paralysis of the muscle or relaxes the muscle membrane. That is called as a muscle relaxant, right? So, muscle relaxant, what we need to remember, where will the muscle relaxant work or where will the muscle relaxant act, right? First of all, muscle relaxant is used for surgical site paralysis. Muscle relaxant is used for surgical site paralysis. And this muscle relaxant has been classified into two categories. One category is called as non-depolarizing, other is depolarizing muscle relaxant. One is non-depolarizing and other is depolarizing muscle relaxant. In depolarizing muscle relaxant, we are having only one drug which is called as scoline. The other name for scoline is succinylcholine, or it is also called as succinylcholine. It is also called as succinylcholine, right? So one drug having three names, scoline or succinylcholine or succinylcholine, is a depolarizing. Whereas in non-depolarizing, you are having the muscle relaxants which are ending with the term curiums and which are ending with the term curoniums. Okay, we will discuss that, what are those and all. First of all, whenever you give this muscle relaxant, where will it act? Muscle relaxant causes paralysis of the muscle, but where should it act, and when it acts on that part, how the action will come? So basically, what is the mechanism of action? Where will the muscle relaxant act? Whenever you give this muscle relaxant, it goes between the area between the nerve and the muscle, right? This is the area between the nerve, and this is nerve, this is muscle, and this is the junction between the nerve and the muscle, right? Whenever you give this muscle relaxant, it goes on to the neuromuscular junction. It works on the neuromuscular junction and it blocks what receptor, guys? It blocks the acetylcholine receptor. This is the acetylcholine receptor which I have drawn. It blocks the acetylcholine receptor. So remember, guys, where is the muscle relaxant working? The muscle relaxant works on the neuromuscular junction. What is the mechanism of the muscle relaxant? It works on the neuromuscular junction and blocks the acetylcholine receptor. It blocks the acetylcholine receptor, or it is also called as NM receptor. By what mechanism is it blocking? There is a mechanism by which it is blocking the NM receptor. The mechanism by which it blocks the NM receptor is called as competitive antagonism. It is called as competitive antagonism. Right? So it blocks the acetylcholine receptors by a mechanism called as competitive antagonism. Right? So anyways, guys, this is regarding the muscle relaxant. Right? This is regarding the introduction of muscle relaxant. Whenever you give the muscle relaxant, they work on the neuromuscular junction, blocks the acetylcholine receptors by a mechanism called as competitive antagonism, and hence they cause paralysis of the muscle. Right? So I told you there are two kinds of muscle relaxant. One category is called as depolarizing muscle relaxant. Other category is called as non-depolarizing muscle relaxant. In depolarizing muscle relaxant, you are having scoline or succinylcholine or succinylcholine. Whereas in non-depolarizing, in depolarizing you are having this one. Whereas in non-depolarizing, you are having the drugs which are ending with the term curiums and the drugs which are ending with the term curoniums. Right? So guys, muscle relaxants we have discussed. We have discussed the two classifications. I told you one is depolarizing, which is succinylcholine, other is non-depolarizing. Right? In non-depolarizing, you are having curiums and curoniums. There is no such classification given, guys, curiums and curoniums. But one, the curiums are belonging to steroidal, these are steroidal muscle relaxants. And curoniums are, these are, remember, non-depolarizing are classified into the steroidals, which are curoniums, and the curiums are what, guys? The curiums are, I'm writing it over here, curiums are benzylquinoliums. Curiums are benzylquinoliums, whereas curiums are steroidal muscle relaxants. Okay. So anyways, we are talking about what? We are talking about the classification. They are classified into non-depolarizing and depolarizing. Non-depolarizing is classified into curiums and curoniums. Right? Curiums are benzylquinoliums, and whereas curoniums are steroidal muscle relaxant. Now guys, whenever you give this muscle relaxant, the patient muscles will relax, and when you go into the reversal phase, we give a reversal agent against the muscle relaxant. The reversal agent that is given against the muscle relaxant is called as neostigmine. If you guys remember, in the reversal phase of general anesthesia, I told you the reversal agent that is given against the muscle relaxant is what? Neostigmine. But we can't give plain neostigmine. Why? Because if you give plain neostigmine, it will cause bradycardia. So what we do? We mix neostigmine with either atropine or glycopyrrolate and we give it in the reversal phase. So guys, this was the introduction of muscle relaxant. We have already discussed where are they working. The site is what? They work on the neuromuscular junction, blocks the NM or the acetylcholine receptors. By what mechanism? By competitive antagonism. To reverse the effect of the muscle relaxant, what are we giving? To reverse the effect of the muscle relaxant, we give neostigmine. But if you give plain neostigmine, bradycardia will happen. So what we are doing guys, with neostigmine, we either give glycopyrrolate or atropine. Now guys, remember, whenever you give this muscle relaxant to a patient, what are the first muscles in the body of the patient to be relaxed? The first muscles in the body of the patient which are to be relaxed are the head and neck muscles. The sensitive muscles to muscle relaxants are the head and neck muscles. Head and neck muscles. Whereas the more resistance means they are last to be relaxed. The muscles which are last to be relaxed in the body are the abdomen and diaphragmatic muscles. The abdomen and diaphragmatic muscles. Right? Head and neck muscles are first to be relaxed. Abdomen and diaphragmatic muscles are last to be relaxed in the body. Right? So now guys, we have already discussed the classification. I told you depolarizing only one is there, which is called as succinylcholine, which is also called as what guys? Succinylcholine is also called as scoline, or it is also called as succinylmethonium. It is also called as succinylmethonium. Right? In depolarizing only one man army, whereas in non-depolarizing drugs there are many. Whereas in non-depolarizing there are many. In non-depolarizing, what are the drugs guys in non-depolarizing? I have already told you the drugs which are ending with the term curiums. The drugs which are ending with the term curium, benzylquinoliums, right? And the drug which are ending with the term curoniums, which are the steroidal muscle relaxant. Curiums example are Acetylcholine, Cisatracurium, next Mivacurium, next Doxacurium, next is Doxacurium. Whereas curoniums, what are the examples of curoniums? There is Pancuronium, there is Vecuronium, and there is Rocuronium. Right? And before coming to the curiums and curoniums, the first introduced non-depolarizing muscle relaxant was D-tubocurare. D-tubocurare. Okay, we are discussing about the non-depolarizing. First, we'll discuss the non-depolarizing muscle relaxant, then we'll go to the depolarizing. So guys, let us learn the muscle relaxant with a story, right? So all of you remember what happened on 16th October. What happened on 16th October, guys? 16th October 1846, there was a guy who gave ether to the patient, which made the patient unconscious. At the same time, there was no cardiotoxic effect. We are talking about which guy? We are talking about W.T.G. Morton. On 16th October 1846, he gave the first public demonstration of ether anesthesia, and that's why it is celebrated as World Anesthesia Day. So on 16th October, from 16th October, in the next coming months also, only ether was used to make the patient unconscious. Chloroform was not at all used. We were just using ether to make the patient unconscious. Surgeons were very happy. The patient was happy. The anesthetists were happy that the patient is unconscious and all. But what surgeons told, after some time, surgeons noticed something, that ether is making the patient unconscious. But what problem they were having? During surgery, the patient muscles were very much tensed. The patient muscles were very much tensed. When they are trying to stretch the abdomen, open the abdomen, the muscles were very much tensed. So what they requested, they came to Morton and told that you discovered ether for unconsciousness. Can you give a muscle relaxant drug? Can you give a drug that causes relaxation of the muscle? Right? When they were discussing this with Morton, there was a public. The public means basically there was some physician standing over there. One physician whose name was Harold Griffith, he raised his hand and he told what? I will give a muscle relaxant to a patient so that the muscles will relax. Right? He told that you can call Morton for giving ether, but you should call me to give muscle relaxant. So the surgeons told, okay, you take your time and come up with the muscle relaxant. So he took some time, he took 1.5 to 2 years to discover a muscle relaxant. And the first introduced non-depolarizing muscle relaxant, which was introduced by Harold Griffith. The name of the guy was Harold Griffith. That muscle relaxant is called as D-tuberculare. That muscle relaxant was called as what, guys? D-tuberculare. So when D-tuberculare was given to the patient, the muscles of the patient were relaxed, but at the same time, they also noticed something. This D-tuberculare is causing a good muscle relaxation, but at the same time, what is it doing, guys? This D-tuberculare is producing severe hypotension. D-tuberculare causes maximum ganglion block that leads to severe hypotension. Due to this reason, the surgeons told Harold Griffith that you have done a wonderful discovery in the field of muscle relaxant, but we won't use this D-tuberculare. Why? Because the patient was developing what? Remember, before giving D-tuberculare, patient's BP was 120/70. After receiving D-tuberculare, patient BP was becoming 50/20. It was causing severe hypotension. Nowadays, guys, we are having many drugs to manage this kind of hypotension and all, right? But back in those days, there were no drugs to manage hypotension. If the patient was developing hypotension, within no time, the patient was developing circulatory collapse and cardiac arrest also. So, what surgeons told? We can't use this D-tuberculare. We won't use it. Why? Because it is causing severe hypotension. Instead of D-tuberculare, if you introduce some other muscle relaxant, we will use that. When they told this thing to Harold Griffith, he became depressed. Why? Because he gave 1.5 to 2 years to discover this drug called as D-tuberculare. It was prepared from plant derivative, but why it was not used? Why? Because it was causing severe hypotension. So he went into depression, and you guys know, once a guy or once a girl goes into depression and you tell her or him to perform, they can't perform well, right? So now, guys, look over here. What happened? They requested Harold Griffith. He did not perform, but they were a group of anesthetists who discovered the next introduced muscle relaxant, whose name was Cisatracurium. First was D-tuberculare. The second introduced was Atracurium. Atracurium, right? When Atracurium came into the market, first of all, why Atracurium was needed? Why? Because D. tuberculare was causing severe hypotension. So, in place of D. tuberculare, we are using what? Atracurium. Atracurium is a muscle relaxant that causes relaxation of the muscle with minimal hypotension. Minimal hypotension meaning what, guys? Before giving Atrac, the BP will be 120/70. After giving Atrac, the BP will be 100/70. Is there any fall in the BP? Yes, but a minor fall is there. There is a minor fall in the BP. That does not mean the patient is hypotensive. That doesn't mean the patient is hypotensive. So remember, guys, Atracurium was a muscle relaxant that was introduced in place of D. tuberculare, and this Atracurium was causing relaxation of the muscle. At the same time, there was no hypotension. Do you remember, guys? This was one point of Atracurium. After 3 months of discovery of Atracurium, this Atracurium was called as a wonder muscle relaxant. It was called as wonder muscle relaxant. Why Atracurium was regarded as a wonder muscle relaxant? Now don't tell me that it causes minimal hypotension. No. Atracurium is called as a wonder muscle relaxant. Why? Because after 3 months of its discovery, everyone were discussing about Atracurium. It's a wonderful drug. But why it was a wonderful drug? The reason is what? Atracurium is metabolized by a magical metabolism or a spontaneous metabolism process, which is called as Hoffman degradation or Hoffman elimination. Right? Now, guys, remember, whenever you take any drug, leave Atracurium, whenever you take any drug, where does it get metabolized? It gets metabolized in the liver. Where does it get excreted? It gets excreted through the kidneys. That is the normal process. So whenever you take a normal drug, it gets metabolized in the liver and excreted through the kidney. If you are having hepatic failure or renal failure, can you take the drug? No. Can you take the drug which is having metabolism in liver? No. But Atracurium was neither metabolized in the liver nor excreted through the kidneys. It was undergoing a spontaneous metabolism and degradation process, which is called as Hoffman degradation or Hoffman elimination. Which is called as what, guys? Hoffman degradation or Hoffman elimination. That is a spontaneous degradation of the drugs. That is a spontaneous degradation of the drug. Right? What is happening in Hoffman degradation? What is happening is not Hoffman degradation or Hoffman elimination. Right? As it is bypassing the liver, as it is bypassing the kidney, as it has nothing to do with the liver or kidney, Atracurium was regarded as a wonder muscle relaxant. Why? Why? Because it can be safely given in hepatic failure as well as renal failure. Why? Because it has nothing to do with the hepatic system or renal system. But after 3 months, it was wonder muscle relaxant. After 6 months of Atracurium discovery, then we came to know our Atracurium is also having some side effects. Atracurium also has some side effects. What side effects Atracurium had? Atracurium was releasing histamine, and Atracurium was, whenever you give Atracurium as a long-term infusion, it releases a toxic compound called as laudanocin. After how many months? 6 months. So guys, it happens, guys. It's a human nature. Whenever you buy a new car, or whenever you go into a new relationship, you will always see the good aspects of your partner. If you are buying a new car, you will see the good aspects of it. Same happened with Atracurium. When it was released, everyone was just telling, "Arey, it is a wonder muscle relaxant, nothing to do with the liver, nothing to do with the kidney, undergoing Hoffman degradation." But after 6 months, they came to know this Atracurium is having side effects. Same happens with the relationship. Same happens with the car. After 6 months of usage or after 6 months of relationship, they will come to know, Okay, this guy is having some problem, this girl is having some problem and all, right? Same happened with Cisatracurium. After 6 months, they came to know our Cisatracurium is having two side effects. What two side effects, sir? It was releasing histamine, and the other side effect of Cisatracurium was what? When you give Cisatracurium as a long-term infusion in an ICU patient to relax the muscle, what was happening? The patient was landing up into seizures. Why? Because Cisatracurium forms a toxic metabolite in the blood, which is called as laudanacine. Which is called as what, guys? Laudanacine. So after the discovery of Cisatracurium, the anesthetist, the surgeons, they came to the anesthetist. They told, Cisatracurium discovery was spot on, sir. Why? Because it was being metabolized in the by Hoffman degradation. It was spot on. But sir, they are having two side effects. Cisatracurium is having two side effects. What two side effect? What two side effect? Histamine release and laudanacine formation. Due to these two side effects of Cisatracurium, what happened, guys? Due to these two side effects of Cisatracurium, due to these two side effects of Cisatracurium, the anesthetist, the surgeons, they told at the anesthetist that instead of Cisatracurium, can we give some other drug? Can we use some other drug instead of Cisatracurium? And then came the next introduced muscle relaxant, which was called as Cisatracurium. Remember, guys, the anesthetists at that time, when they heard that these two side effects are there, they got offended. They thought, basically, they introduced a wonder muscle relaxant. They were feeling like a celebrity. When the surgeons told that your wonder drug is having two side effects, they got offended. But after some time, they also realized two side effects are there: histamine release and laudanacine. So what the anesthetist did? They were so much obsessed with the Cisatracurium molecule that they did research on the Cisatracurium molecule. They came up with the next muscle relaxant which was introduced into the market, which is called as Cisatracurium. Which is called as what, guys? Cisatracurium. Right? Now, why was Cisatracurium released? Cisatracurium was having side effect. Cisatracurium is an isomer of Cisatracurium, 3 to 4 times more potent than Cisatracurium. Where is Cisatracurium metabolized? In the same place, sir, where Cisatracurium was metabolized. What same place, sir? By Hoffman degradation or Hoffman elimination. How about the side effects? Cisatracurium was having two side effects of histamine release and laudanacine, whereas Cisatracurium has very minimal side effect. It produces less histamine, it produces no histamine, and it produces less amount of laudanacine that cannot cause seizures. So basically, Cisatracurium is the muscle relaxant which is free from side effects of Cisatracurium. If at all, guys, the MCQ is asking you which is the muscle relaxant of choice for hepatic and renal failure, and the options in front of you are Cisatracurium and Cisatracurium, you guys tell me which one will you choose for? Will you choose for Cisatracurium or will you choose for Cisatracurium? Which one will you choose for, guys? Attrac or Cisatrac? Which one? Always you go for Cisatracurium. Why? You go for a drug which is having less side effects. If Cisatracurium is not there, the second best choice for hepatic renal failure is Cisatracurium. The second best choice is Cisatracurium. So after Cisatracurium discovery, the anesthetist thought our work is done. They were relaxing now. Thinking that their work is done. But was it done? It was not done. What happened? There were two group of surgeons who came to the anesthetist and they told what? Sir, nowadays, first group of surgeons, they came to the surgeon and they came to the anesthetist and they told what? Nowadays, sir, we are getting patients on daycare surgery purpose. Daycare surgery purpose. You know what is daycare surgery? Surgery on the same day, discharge on the same day is called as daycare surgery. The surgeons told the anesthetist, you gave an agent called as propofol for daycare surgery. Can you give a muscle relaxant? Can you invent a muscle relaxant that could be used for daycare surgery? As Attrac and Cisatrac were not used for daycare, they wanted a muscle relaxant that acts for a shorter duration used for daycare surgery. So next came the shortest acting non-depolarizing muscle relaxant on the request of group 1 surgeons whose query was daycare surgery. So the next introduced muscle relaxant was the shortest acting non-depolarizing muscle relaxant, which was called as Mivacurium. Mivacurium. It is the shortest acting non-depolarizing muscle relaxant used for daycare surgery, right? Apart from that, where is Mivacurium metabolized? Where is Mivacurium metabolized? Mivacurium is metabolized in the plasma by plasma pseudocholinesterase. By plasma pseudocholinesterase. Come on guys, plasma pseudocholinesterase. Can you recollect any point? Where were some drugs metabolized in, who were the drugs which were metabolized in the plasma? Amino esters were metabolized in the plasma by plasma esterases or plasma pseudocholinesterase. So Mivacurium is also metabolized by plasma, right? It is the shortest acting non-depolarizing. This you have to get this point. Shortest acting non-depolarizing muscle relaxant, right? More short than Miva is Gantacurium, but still studies is going on. Still we haven't come to a conclusion, so we can't say it as a shortest. Shortest acting non-depolarizing is Mivacurium. Group 1 surgeon's query was solved. Second group surgeon's query was what? They were telling that, sir, nowadays we are getting the patients for long duration surgery. The surgery was done in a longer duration, 6-hour surgery or 8-hour surgery. And they requested the anesthetist that your Atracurium and Cisatracurium are working only for 20-25 minutes. After every 25 minutes, we have to repeat the dose and all. So they requested the anesthetist that instead of all these, can you introduce a long-acting muscle relaxant? So the next introduced muscle relaxant on the request of the surgeons for a longer-acting drug. Next introduced muscle relaxant was the longest-acting non-depolarizing muscle relaxant, which was Doxacurium. It was called as what, guys? Doxacurium. But Doxacurium got released, and after a few days, the anesthetist only told, please not to use this Doxacurium. Why they told not to use this Doxacurium? Why? Because Doxacurium was causing muscle relaxation. At the same time, it was producing toxicities of multiple systems of the body. It causes multi-system toxicities. Due to this, Doxacurium is not used nowadays. Doxacurium is not used nowadays. But till date, it remains what? It is the longest acting muscle relaxant. Right? As Doxacurium was producing many system toxicities, it was told that please don't use this Doxacurium. Right? So, but is the query solved, guys? Is the query of the second group of surgeons solved? No. They were having the query, we introduced Doxacurium as the longest and we only told not to use it. So instead of Doxa, the second introduced longest, basically the second longest acting muscle relaxant that was introduced in place of Doxacurium was Pancuronium. Right? Pancuronium is the second longest acting muscle relaxant. This Doxacurium works for more than 120 minutes, but this Pancuronium works for 90 to 120 minutes. 90 to 120 minutes. Is it the longest? No. It is the second longest acting non-depolarizing muscle relaxant used in the place of Doxacurium. Now coming to Pancuronium, guys, second longest acting muscle relaxant, right? Now, in this Pancuronium, what we need to remember, whenever you give a Pancuronium dose to the patient, it will cause muscle relaxation. With that, it causes some effects on the patient. It has some effect on the patient. As you give Pancuronium to the patient's BP, the patient pulse rate will increase. Pancuronium, as you give it to the patient, what will happen to the BP and pulse rate of the patient? The patient's blood pressure and patient pulse rate will increase, right? Hence, remember guys, what was the IV induction agent that was increasing the BP and pulse rate? The IV induction agent that increases the BP and pulse rate was ketamine. As it was increasing the BP and pulse rate, it was regarded as a IV induction agent of choice in shock. Whereas Pancuronium also increases the BP and pulse rate. As it is increasing the BP and pulse rate, Pancuronium is regarded as the muscle relaxant of choice in shock. It is regarded as what, guys? Muscle relaxant of choice in shock. So that is one point. Next point of pancuronium that we need to remember is pancuronium is second longest acting, but in some patients we can't judge when is the duration ending. In some patients the duration might be prolonged also. We don't know the reason why it is being prolonged. So pancuronium, if you give it to the patient, you have to be ready to face a complication that patient might have a delayed recovery. Patient might have a delayed recovery. The third point of pancuronium is what? Pancuronium is having maximum renal excretion. Hence, can you give pancuronium in renal failure if it is having renal excretion? No. Hence, it is avoided in the patients who are suffering with renal failure. So we are discussing about what? We are discussing about the muscle relaxant called as pancuronium. Before going to pancuronium, guys, first we'll discuss what? I told you in non-depolarizing, the first introduced non-depolarizing was what, guys? D-tuberculare. Who introduced this D-tuberculare? This D-tuberculare was introduced by Harold Griffith. Harold Griffith. But what side effect of D-tuberculare was seen? D-tuberculare releases maximum histamine, leads to severe hypotension, right? It causes maximum ganglion blockade and releases histamine leading to severe hypotension. So are we using it? We are not using D-tuberculare nowadays, right? So the next introduced muscle relaxant that came into the market was Atracurium. Atracurium, I told you when it was introduced, it was a wonder muscle relaxant. Why? Atracurium is metabolized by Hoffman degradation or Hoffman elimination. Hoffman degradation or Hoffman elimination. Okay, it's a non-enzymatic spontaneous degradation of the drug. As it is bypassing the liver, as it is bypassing the kidney, it has no problem. It has no problem on liver and kidney. Due to this reason, Atracurium is regarded as muscle relaxant of choice for hepatic and renal failure. It is a muscle relaxant of choice for what failure, guys? Hepatic and renal failure. It is a muscle relaxant of choice for hepatic and renal failure. But guys, remember, it was the muscle relaxant of choice. Now it is not. Why? Because of two side effects. What two side effects? First side effect, it causes histamine release. Second side effect, it produces a toxic metabolite on long-term infusion. What is that metabolite called as? Laudanosine. That can cause seizures. Right? It produces a metabolite called as laudanosine that can cause seizures. That was regarding what? That was regarding Atracurium. Next after Atracurium is what? Cisatracurium. Right? When you compare Cisatracurium and Atracurium, tell me guys, which is the more potent drug? The next introduced is Cisatracurium, which is more potent. It is 3 to 4 times more potent drug, right? It is an isomer of Atracurium. Why was this released, guys? Why? Because our Atracurium was having two side effects. What two side effects, sir? It was causing histamine release and it was causing laudanosine formation, right? Cisatracurium is 3 to 4 times more potent than Atracurium. It is an isomer of Atracurium. It also undergoes Hoffman degradation. What about the side effects, guys? The side effects associated with Cisatracurium are very less when compared to Atrac. Actually, this causes no histamine release. There is no histamine release and it produces less amount of laudanosine that will not cause seizures. It produces less amount of laudanosine that won't cause any seizures. So, which is more preferred drug? Atrac or Cisatrac? Which is more preferred? Cisatracurium is always anytime more preferred than Atracurium, right? But after Cisatracurium, I told you two group of surgeons came. The first group of surgeons, what was their query? Their query was they wanted a shortest acting non-depolarizing muscle relaxant. Why was Mivacurium introduced? Mivacurium was introduced as a shortest acting non-depolarizing muscle relaxant, right? So, it is a shortest acting what muscle relaxant? Non-depolarizing. That's very important. right? And this was introduced for what? The query of the surgeons was, we want a muscle relaxant for daycare surgery. That was the question, that was the query. So the muscle relaxant of choice for daycare surgery was Mivacurium. Where was Mivacurium metabolized? In the plasma by plasma pseudocholinesterase. I told you more short than Miva is what? Gantacurium. But are we using Ganta? We are not using. Why? Because it's not clinically available. So this query, this surgeon's query is done. The other group of surgeons, they came with the query of what? We want a long-acting muscle relaxant. We want a long-acting muscle relaxant. That was the query. The next longest-acting non-depolarizing muscle relaxant was Doxacurium. It is the most potent, the longest, as well as the most toxic muscle relaxant. Most toxic muscle relaxant. The duration of Doxacurium is how much, guys? The duration of Doxacurium is more than 120 minutes. It works for more than 120 minutes, right? It works for more than 120 minutes. But as it is having some toxic effects, are we using Doxa? We are not using Doxa. In case of Doxa, we are using what? Pancuronium. We are using what, guys? Pancuronium. Pancuronium is the second longest acting muscle relaxant. Pancuronium was the second longest acting muscle relaxant. The duration of Pancuronium is 90 to 120 minutes. The duration of Pancuronium is 90 to 120 minutes. But I told you some points of Pancuronium. Guys, you remember? I told you Pancuronium increases the BP and pulse rate. Hence given in shock. Muscle relaxant of choice in shock. Next, Pancuronium causes a side effect called as delayed recovery. Last patient is, if Pancuronium is contraindicated in renal failure as it is having maximum renal excretion. All these three are MCQs of Pancuronium. How will we remember those? Remember, guys, Pancuronium starts with what alphabet? Pancuronium starts with what alphabet, guys? Pancuronium starts with the alphabet. Pancuronium starts with the alphabet P. Pancuronium starts with the alphabet P. If you add a stroke to this P, it becomes R. It becomes R. Always remember, guys, with Pancuronium, if anyone is asking you anything of Pancuronium, your immediate answer should be, with this R, you have to remember R, R, R. Pancuronium immediate answer should be RRR. You guys have watched the movie RRR. RRR. RRR was a pan-India movie. So you can remember RRR is the mnemonic for Pancuronium. Right? So remember, guys, RRR. First R stands for what, guys? First R of Pancuronium stands for rate. It increases the rate. What rate, sir? Increases the BP, increases the pulse rate. Hence, it is the muscle relaxant of choice in shock. Second R of Pancuronium is what? Second R of Pancuronium is recovery. How is the recovery with Pancuronium? Delayed recovery. There is delayed recovery. As it is having long duration, the patient might have delayed recovery. The third R of Pancuronium is renal failure. Pancuronium is contraindicated in renal failure. Why? Because it is having renal excretion. 3 R's of what, guys? Pancuronium. Pancuronium. Triple R should be the answer. Right? This is regarding what? This is regarding Pancuronium. After the discovery of Pancuronium, the next introduced muscle relaxant is Vecuronium. The next is what, guys? Vecuronium. Now, whenever we are discussing about Vecuronium, I used to write Vecuronium in this fashion, guys, so that I could remember Vecuronium is which muscle relaxant. I used to write Vecuronium V like this. Whenever I used to write the Vecuronium V, I used to draw it like a heart, so that it looks like a heart, right? Why is it looking like a heart? What is the importance of it? Vecuronium is regarded as the most heart-stable muscle relaxant or most cardio-stable muscle relaxant. Which was the most cardio-stable IV induction agent? The most cardiostable IV induction agent was etomidate. Was what, guys? Etomidate. Which is the most cardiostable muscle relaxant? The most cardiostable muscle relaxant is Vecuronium. What is the meaning of cardiostable, guys? Cardiostable यानी कि any drug that maintains the BP and pulse rate is called as cardiostable drug, right? So Vecuronium is the most cardiostable muscle relaxant which is indicated for a patient who is suffering with heart disease, right? That is a very important point of Vecuronium. It's the most cardiostable muscle relaxant indicated for cardiac patients. But this Vecuronium is having excretion through the biliary tract. This Vecuronium is been having excretion through the biliary tract. It's being excreted from the biliary tract. As Vecuronium is having excretion through the biliary tract, remember, if the patient is suffering with obstructive jaundice, can you give Vecuronium? No, sir. If you give Vecuronium in the patients who are suffering with obstructive jaundice, what will happen? This Vecuronium will get accumulate in the patient's body, leading to toxicities and all, right? So remember, Vecuronium is having significant dash excretion. What is the dash? Significant biliary excretion. Hence, it is avoided in the patients who are suffering with obstructive jaundice. So, if the patient is having obstructive jaundice or if the patient is having hepatic failure, the only muscle relaxant that could be safely given in obstructive jaundice or hepatic failure is what, guys? Cisatracurium, the best choice. If Cisatrac is not there, you go for Atracurium. If imagine Cisatrac and Atrac both are not there, then you go for Mivacurium. Why do you go for Mivacurium, guys? Cisatrac and Atrac, you can easily tell. Cisatracurium and Atracurium are metabolized by Hoffman. They have nothing to do with the liver, sir. That's why I am using. But why Mivacurium is a third choice? Why? Because you have to tell, sir, Miva is a third choice. Why? Because Miva is also having no dependence on liver. Mivacurium is also metabolized in the plasma by plasma pseudocholinesterase. Right? So remember, guys, we are talking about Vecuronium. Vecuronium is the most cardiostable muscle relaxant indicated in heart disease, but it's having biliary excretion, hence avoided in the patients who are suffering with obstructive jaundice or hepatic failure. Right? When you give Vecuronium for a long-term infusion, as you give Vecuronium as a long-term infusion, there is a metabolite being formed in the blood which is called as 3-hydroxy metabolite. Which is called as what, guys? 3-hydroxy metabolite. Hence we are avoiding Vecuronium as a long-term infusion. So Vecuronium should never be given as a long-term infusion. It leads to formation of a 3-hydroxy metabolite. Okay? Next, coming to the next drug which is called as Rocuronium. Guys, I used to remember Rocuronium as a painful rock star. In the non-depolarizing, the next muscle relaxant is Rocuronium. I used to always write Rocuronium as a painful rock star. Why, sir? Why Rocuronium you used to call painful rock star? Why? Because in the muscle relaxant category, it is the only muscle relaxant that causes pain during injection. As you are giving pain to the patient, as you are giving muscle relaxant to the patient complains of pain. No other muscle relaxant causes pain, only Rocuronium causes pain. Why it is called as a rock star of muscle relaxant? Why? Because it behaves like a rock star. Guys, imagine if you call a rock star to a concert, he will come to the concert, he will perform, and then he will directly go to the other concert. He won't be waiting there for a long time. 1 hour time, if he is given 1 hour, within 1 hour or 45 minutes he'll perform and he'll go off. Right? He is a fast acting person. Why? Because he has to earn more money. Rocuronium is also the rock star of muscle relaxant. Why? Because it is the fastest acting non-depolarizing muscle relaxant. Now guys, what is the difference between the fastest and the shortest? The shortest acting was Mivacurium. Why Mivacurium was shortest? Why? Because it was having short duration of action. Why is Rocuronium the fastest? Why? Because the onset of Rocuronium is the fast. So Rocuronium, when you give, within 60 to 90 seconds, the patient muscles will be relaxed. Hence, it is the fastest acting non-depolarizing muscle relaxant. Fastest acting non-depolarizing. Once again, I am emphasizing on this point. Fastest acting non-depolarizing. Shortest acting non-depolarizing, Miva. Fastest acting non-depolarizing, Rocuronium. Right? So remember, Rocuronium is a painful rock star. Rocuronium is usually indicated for endotracheal intubation. ET is nothing but what, guys? Endotracheal intubation. Rocuronium is indicated for endotracheal intubation. It is having a fast onset of how many seconds? 60 to 90 seconds. It is the fastest acting non-depolarizing muscle relaxant, right? It is considered as an alternative muscle relaxant in place of succinylcholine when a patient is posted for rapid sequence induction. When a patient is posted for what, guys? Rapid sequence induction. Something that strikes to your mind when you are listening about rapid sequence induction? Rapid sequence induction is the same thing. Rapid sequence induction is the same thing that we have discussed. It is general anesthesia given to a full stomach patient. You guys remember rapid sequence induction, what we do? How do we give pre-oxygenation to the patient in rapid sequence induction? We pre-oxygenate by normal mask or bag mask. You can recollect, I won't be telling. Then after pre-oxygenating, you go for induction. Immediately after giving IV induction, will you go for muscle relaxant? No. You will ask your assistant to put pressure. What is that pressure? Again, you have to recollect that. I am not clearing it. Right? Last thing, when is that pressure removed? That I can tell you. The pressure is removed after intubating and inflation of the cuff. Okay? So anyways, guys, in rapid sequence induction, you have to give a short-acting muscle relaxant. The Scoline is the best. But if Scoline is not there, you can go for Rocuronium. It's an alternative muscle relaxant to succinylcholine for rapid sequence induction. So remember, guys, Rocuronium is a painful rock star. Why it is a painful rock star? It is a painful injection. Why it is a rock star? Why? Because it is the fastest acting non-depolarizing muscle relaxant. Right? This is regarding what? This is regarding Rocuronium. This is regarding Rocuronium. Right? Now, guys, coming to the next muscle relaxant, which is called as Gallamine. Next is called as what, guys? Gallamine. Now, regarding Gallamine, what we need to remember, did we discuss about Gallamine anywhere, any place? We haven't discussed about Gallamine. Why? Because Gallamine is non-depolarizing muscle relaxant, which is not at all used nowadays. Why not at all used? As it is the least potent and is having many side effects. It's the least potent drug having many side effects. What side effects, sir? You can't give Gallamine to a renal failure patient. Why? Because it's having renal excretion. You can't give Gallamine to a pregnant lady. Why? Because it causes placenta, leading to teratogenic effects. All in all, Gallamine is the waste muscle relaxant. Hence, we have not discussed in the introduction or classification also. But the important point of Gallamine, remember, guys, Gallamine is not used nowadays. Why? Because it's the least potent, contraindicated in pregnancy and contraindicated in renal failure. But the most important point of Gallamine is regarded as the most sensitive muscle relaxant, in patient with myasthenia gravis, or in patient, Gallamine is the most sensitive muscle relaxant in Amitabh Bachchan. I can say myasthenia gravis or Amitabh Bachchan, both are same. Both are same or different? Both are different, but why am I telling Amitabh Bachchan? Why? Because Amitabh Bachchan has myasthenia gravis, okay? So, most sensitive muscle relaxant in patients with myasthenia gravis is Gallamine, hence avoided in myasthenia gravis patient. Hence, avoided in those patients. Okay? So, that is regarding what? That is regarding the non-depolarizing muscle relaxant. That is regarding the non-depolarizing muscle relaxant. Right? So once again, guys, non-depolarizing are divided into the benzyl quinoleums and the amino steroids. यानी कि non-depolarizing are divided into benzyl quinones and steroidal agents. Now, what we need to remember in benzyl quinones are curiums, Atracurium, Cisatracurium, Mivacurium, Doxacurium. Whereas in steroids or curoniums, what are the examples? They are curoniums. We have discussed, no, curoniums. What are the curoniums that we need to discuss? The Pancuronium, the Vecuronium and Rocuronium. The Pancuronium, Vecuronium and the Rocuronium. Right? Pancuronium, Vecuronium and Rocuronium. Okay. So that was regarding what? That was regarding the classification, and that was regarding the non-depolarizing muscle relaxant. Okay. Try to remember it with the story that the first introduced was daycare. First introduced non-depolarizing was daycare, not used due to severe hypotension. The next came Atracurium, which was a wonder muscle relaxant due to Hoffman degradation. But after some time, two side effects, histamine release and laudanacine. More good than Atracurium is Cisatracurium. Then came the shortest acting, two groups, no, shortest acting was Mivacurium. Then came the longest acting muscle relaxant called as Doxacurium. Then came the second longest acting called as Pancuronium. Then came the most cardiostable muscle relaxant, which is called as Vecuronium. Then came the painful rock star or the fastest acting, which is Rocuronium. Last was Gallamine, the sensitive muscle relaxant in myasthenia gravis patient. That finishes our non-depolarizing